you never know what tiny little thing could send them sideways and unfortunately miss the opportunity to experience the life-changing benefit of chiropractic care in your office. Welcome to AMC. I'm Dr. Greg Miller. Have you ever realized that your patients also have an innate? Today, I'm going to share some lessons that I've learned over the years about a patient's perception. You won't want to miss my story about one of the busiest days in my practice. If you find this video to be helpful, please click the like and subscribe buttons. Let's get started. Well, greetings everyone. Dr. Greg Miller coming at you again from AMC, and just wanted to have a little bit of a different kind of a conversation today. We're going to talk about innate, but we're going to talk about it from just a little bit of a different perspective. Let me ask you a couple of questions here. In practice, have you ever had the experience where a new patient calls, books on your schedule, and never shows up for the appointment? How about a patient who comes in for their first visit, you think everything's going great, and then they never come back for any subsequent visits? They're gone. How about they're doing great under care, and again, suddenly they disappear off the radar and you never hear from them? What about the patient that's doing fantastic under care? You think you have a tremendous relationship with them. They're getting great results. They're back doing that thing that brought them into the office because they couldn't play golf anymore, they couldn't work anymore, whatever it was. And you realize, wait a minute, that patient has never referred a new patient into this office. What about the patient who you know is getting better? You can watch them. You watch them as they're walking in and out of your office. You watch them and you ask the questions and they give the correct responses, but they refuse to acknowledge that they're getting better under care. What could possibly be wrong? Well, here's a thought. I know that you recognize what innate is. If you're a chiropractor and you're watching this video, you know what innate is. Some of us a little different than others, but certainly we understand and recognize that we have an innate and we can communicate with that innate. But guess who else that you interact with every day in that office also has an innate? Yes, that's right. Your patients. They absolutely do have an innate. And here's what I've learned over the years is you never know what tiny little thing could send them sideways and unfortunately miss the opportunity to experience the life-changing benefit of chiropractic care in your office. Now, what I'm talking about, let's just step outside your office for a minute. I've seen a lot of offices over the years where you walk up to the front door and the parking lot is a mess. And I'm talking about weeds growing up through the cracks in the asphalt. I'm talking about lines not painted, crisp and clean lines not painted. I'm talking about walking up to the front door and the windows are dirty, the glass is dirty, the letters are crooked, or the sign is in disrepair. They haven't done anything to really make it inviting. You look, putting a couple of potted plants on either side of the front door with a red carpet in the front literally does so many things. Number one, it just innately encourages the patient that, hey, you're coming home. This is the right place to be. But also, if they're having trouble finding you or they think they might be having trouble finding you, just tell them, hey, we got the red carpet right out front door waiting for you. So that can make a tremendous difference in what a person's innate experience is as they walk into your office. You know, many times a patient has never gone to a chiropractor before and they're tentative about it. They've heard different stories and they're concerned, but yet at the same time, they want to see if chiropractic can maybe help them. Look, we don't want anything to deter them from the experience that they can potentially have in your office. So that experience of walking up to the front door is really important. What about when they step into the waiting room? What greets them when they step into the waiting room? Is it a clean environment? Is it a quiet environment? Is it a tidy environment that's inviting to them? Or is it Are they blasted with all kinds of input, including a wall over here or a cabinet over here that's selling pillows and ice packs and maybe supplements, which certainly there's a place for that. But I promise you, Doc, it's not the waiting room, because your new patient's innate perception of that is not going to be positive, especially if they're questioning, what's this chiropractic thing about? Is this really what I want to experience? Are they going to be able to help me? And boom, they walk through the front door and we're trying to sell them things. Or perhaps it hasn't been attended to in a while, and I'm talking about the waiting room, and for that matter, any room in your office. You look up in the corner and there's a couple of cobwebs, there's dust on the side tables and maybe the chairs. They're just, it's run down. The paint is showing wear. There's fingerprints on it, rub marks. You know what I'm talking about. If your office is in that kind of a condition, unfortunately, a patient's perception of that isn't necessarily going to be positive. Will there be some that mow right on past that and don't pay any attention to it? Sure. But there will be others who might fall into those first categories we talked about, where they don't ever come back because of an experience like that in your office. How about this? How about an unintended miscommunication from yourself or from your staff? Something that they said that was misinterpreted by a patient. Maybe it had to do with a financial situation or insurance or something like that. They misinterpreted the comment that, well, we don't take patients with insurance or something along those lines. Look, there's all kinds of different scenarios that can happen. I remember in practice, this was many, many, many years ago. It was I think it was a Friday morning, one of our busiest days in the practice. And this lovely older lady came in and was ready to begin her treatment. And she just had this look on her face. And I said, Miss Jean, what's the matter? She said, I just wish you were taking new patients. My sister just so desperately wants to come in to see you. And I'm like, wait, whoa, wait a minute. What do you mean we're not taking new patients? And she said, well, your waiting room is always so busy, and the parking lots, it's hard to find a place to park. I just assumed that you weren't taking new patients. That's a miscommunication on our part that was leading to her sister not being able to benefit from chiropractic care. So look, what I'm talking about here is putting on the goggles of, what are my patients perceiving? What are they seeing? A great exercise for this is for a weekly staff meeting. You and the staff, everybody gets a legal pad. You go outside the office and you walk through that office as a new patient would. And everybody writes down everything that they see that is positive or negative. And then everybody sits down, goes through it, determine what you're going to do to make that an environment that is welcoming to new patients. And then look, go back out the front door and do it again and follow the path that a patient who is routinely under care, an established patient in your office, would do. So just a couple of thoughts. Be aware of these things. Watch your patients actually become lifetime patients when you make corrections like this. Excited to have spent a little bit of time with you. We'll see you next time. Doc, AMC is your guide to becoming respected, effective, and valued in practice. We know what works, and we prove it with our Grow Guarantee. If we can't help your practice grow, it costs you nothing. Text us at 904-966-4996 for more details. See you next week.